Over the years, hair transplant became a very popular procedure to restore your original look or to get rid of baldness. But do you know, hair transplant procedure is not for all. Even if you are suffering from baldness, you may not be a right candidate for hair transplantation. What are the points that decide whether you are a right candidate for a hair transplant procedures? Let's discuss. First point is your available donor area. Sometimes what happens, the process of baldness is not limited to this front, mid and crown area. This may affect your donor area. This condition is known as DUPA or diffuse unpatterned alopecia. That means the process of baldness also affecting your donor area, leading to thin miniaturized hair. So if this is the case, then you are not a right candidate for hair transplant procedure. Second, if your donor has been depleted because of previous surgeries, then there is no adequate available donor to cover your balding zone, then you are not a suitable candidate for hair transplant procedure. Sometimes there is a discrepancy between the available donor area and area to be covered. Suppose you have a grade 6 or grade 7 baldness and your available donor is very limited and very thin caliber hair, then it's not possible to give a full coverage. Then in that scenario, hair transplant may not be a suitable options for you. Next is your expectations should be realistic. People used to send photographs with reference that they want to get their original density that used to have in their early 20s. You have to understand that in hair transplant, the density that we try to achieve is not the original density. The density that you achieve in hair transplant is known as the cosmetic density. Purpose is to give a coverage in a way so that your scalp won't be visible. Because if you'll see, the available donor area is around 25% and the potential balding zone is around 75%. So in transplant, we give a density which is almost close to 70 or 80% of your natural density, but it's not completely like your original density that used to have in early 20s. Other factor is, even if your donor is good, also the density that you achieve may vary from person to person. Suppose somebody having very thin caliber hair and suppose somebody having thick caliber hair, there will be difference in the density that we achieve. Next is stabilized hair loss. One point you have to keep in mind that hair transplant has nothing to do with your ongoing process of baldness. So if you have a thinning over the rest of the area, you must take medications to stabilize the hair loss to protect your existing hair. And the area where you have lost hair and you have developed already baldness, in that area you can go for hair transplant procedure. Next, coming to the age factor. In general, we follow the principle that we used to avoid hair transplant procedures till 25 years of age, especially somebody having strong family history of developing grade 6, grade 7 baldness. So if you have a mild recession of the hairline and you have a strong family history of developing advanced grade of baldness, you must avoid doing hair transplant procedures in the early age. You must consider taking medical management to stabilize your hair process. But if somebody already developed grade 3, grade 4 baldness, then it can be done safely, but we keep some point in mind while approaching baldness while doing hair transplant in a younger age population. Next is underlying medical conditions. Though hair transplant is a minimally invasive procedure which is done under local anesthesia, still we do some basic screening before the surgery. If you have a diabetes detected for the first time, or if you are not on medication, if your sugar is not controlled, then you must consult your doctors to take the medicines. Once the sugar is controlled, then you can go for hair transplant procedures. There are certain medical conditions in the scalp like alopecia areata, lichen planopilaris. These are all certain autoimmune conditions that affect the scalp, leading to loss of hair. In that condition, we avoid doing hair transplant procedures because the hair may not grow, or if they will grow, they may not last for longer period of time. They may get lost by this autoimmune process. If you are suffering from baldness and you are planning to go for a hair transplant procedures, this point you must keep in mind to know whether you are right candidate for hair transplant procedure. You must consult hair transplant surgeon or dermatologist, discuss your expectation, what you want, whether it is doable or not, and also he or she will customize your treatment plan. So if you consult an expert, then at present hair transplant is completely a safe procedure and is the most natural way to restore your original hair.